reality, I would say, about day-to-day in the ER is that it's very busy. There's very little downtime right now. We're definitely seeing the majority of our COVID patients are unvaccinated. The vast majority of our COVID patients. Those who come in, I'm not saying we don't get any vaccinated patients with COVID, because we do. Their symptoms are much less extensive. They almost always get to be discharged to try to get on the mend at home with their family in their own comfortable settings, versus the people that are coming in with COVID unvaccinated are typically in much worse shape, often have to stay in the hospital, and unfortunately often end up ventilated. I believe that we are currently in the most frustrating time of the pandemic because we have the resources right now to control this. We have developed a very safe, effective vaccine that is now FDA approved fully. And we have run countless tests on masking and on social distancing and on using the vaccine, and we have all the tools in our toolbox to really rein this in, and we're not. And so that's why I would consider this the most frustrating time for healthcare workers in the pandemic. I think all of us in healthcare have gotten pretty good at compartmentalizing our lives right now. To get through the day, I kind of have to shove whatever I'm seeing, into the back of my mind, because I have to walk out of that room and I have to go to another patient's room and greet them with a smile and treat whatever it is that they're going through. So I feel like all of us healthcare workers are kind of just shoving it down until we get to a point, like when I get to the parking garage after my shift and can finally take a break, that's when I start to reflect on everything I've seen and everything I've heard. My motivation for getting the vaccine was not about me, because I am much less likely to contract COVID if I am vaccinated. And if I was to contract COVID and bring it to my house, I do have two immunocompromised children that I could give it to. I have two parents who are in that elderly age bracket that I could give it to. I have neighbors, I have random people that I pass in Target that I could give that to. I don't want to spread COVID. So to me, it's not about protecting myself only. Sure, I don't want to get sick, I don't want to get COVID. Of course I'm vaccinated for that reason, but also about protecting other people. It's about stopping the spread, not just not getting it yourself. It vastly decreases your chances of ending up on a ventilator. And the unfortunate thing with COVID is a lot of those ventilated patients don't come back. And so if we can keep you off the ventilator, like that is the goal with COVID. And we're not seeing hardly any vaccinated patients end up on ventilators. We just aren't. It's keeping people safe.